Hi, my name is Tage. I'm the office manager of Extra Care Concerns. We've been in business for 8 to 10 years. A little bit about ourselves. It's established by a black owner named Dr. Patricia Roberts Harris, aka I know her as my mother. We have been in business for several years servicing patients all around the DFW area for chronic pain, for neuropathy, for anything that you need, we service you. We are here Monday through Thursday from 9 a.m. to 4:30 p.m. We have all the connections in the DFW. Whether you need home health, nursing home, or you just need a family friend, we are here for you. If you need anything or any services, we are here. Just dial 817-534-7300. Thank you.
Hi, I'm Bishop David Thibodeau, and I'm here at the wonderful doctor's office clinic, Extra Care Concerns. And even though I'm a bishop and I have faith in God and I believe that God do all the healing and He does everything, however, we still need a physician as well to take care of all the physical body needs. And here at Extra Care, Dr. Harris here, she's a wonderful lady, and her wonderful staff is here, and they're here to take care of you in all of your medical needs. And if you just need a friend, they'll be a friend to you. Thank you so much, and come out and see us right here at Extra Care Concerns. Thank you.
Good afternoon. My name is Glenn Smith. I work for Dr. Harris for about 11 years, and she's a wonderful person. She got a beautiful personality, and she got a beautiful staff. And we at Dr. Harris' office, we like to reach out to the people and people make the world go round. Without you, we can't do nothing. Don't be scared to come to Dr. Harris' office on Lancaster, 2529 East Lancaster. We'll reach out to you, and then you can reach out for us. Thank you, and God bless you, and have a good day.
Welcome. As my preview has told you, I'm Dr. Patricia Roberts Harris. And I'm here to tell you how allopathic medicine, osteopathic medicine, and holistic medications meet. You hear all of these things about how chemical medicine can help you, but I want to tell you that you can heal yourself. Well, you read about it all the time. It's on the news, it's on the TV, but take it very seriously. Why make the billionaires super rich when you can just do everything yourself? Just get up, take a look in the mirror, and tell yourself, hey, I love you, I can help you, I can guide you. And if that's not enough, if that's not strong enough, if you need a coach, just come on in and we'll talk to you and we'll coach you about all three, especially about holistic, healthy medicine, because health and wealth is happiness. So just come on in. When we have diabetics for the first time, or people that come in for the first time, we always first tell them about healing yourself. We want to take your hand. We want to guide you and tell you all the things that can lead you into better living when you will just take a look at the things that can help you. Of course, we have people who make choices about, do I want to take medicine? Do I want to change my diet? Do I want to exercise? What choices do I make when they're still in my hands? My hands, my mouth, my lips. That's what can change my world. Well, for those people who don't want to change, we offer a medication, because some people simply want to buy into all of the commercials on TV, all of the things, all the fast foods, all the quick fixes about losing weight, all the quick fixes about getting these fine, luscious, lovely bodies. Well, it takes work, it takes time, it takes patience, because as with anything else, if you're going to condition your body, you have got to condition your mind first. I know you know that when you go to the gym, they always tell you it's 90% diet. The coach used to tell us all day, every time we would go, eating cookies, eating chips. Guess what? You can stay in here and you can work out 4 or 5 hours a day, every day, but you're never going to get that look that you want unless you change your mind. Change your mind and keep it changed. I didn't say it was easy. I didn't say that you don't need a companion. That's why a lot of times, that's why the gyms make so much money, because they figure you need a friend, you need a coach, you need somebody around you who's doing the same thing, who's working on the same projects, who's got goals in mind. So when you come with us, we have goals. We've got coaches. We've got a beautiful staff who's going to just keep you going and remind you. Because when you come in, we look good. When you come in, we feel good. When you come in, as the preacher says, you're not going to leave the way you came. So that's what we want you to know, and that's what we believe in.
Dr. Harris, I want to know, and the people out in the audience I'm sure would like to know as well, is it unhealthy, unsafe to take too many supplements?
Well, when someone asks you if it's unhealthy to take too many supplements, then you have to really define that. There's so many kinds of supplements. You have powders, you have vitamins. Just what kind is it you need? Because they have some supplements, say like the powders. You can have them with hemp, you can have them with some that are plant-based, some of them are protein-based. You can even have them that are soy-based, so it's just whatever kind that they have, and that's what defines whether it's too much.
Dr. Harris, how long have you been at this location?
We've been located at 2529 East Lancaster for about 8 years, and we're at this location on a big corner, so we can see all of the traffic that passes by. And guess what? We are near downtown Fort Worth. And coming up soon, there's going to be a rail system that may be 2025, but they're talking about a rail system that's going to come right down in front of us. So we'll be happy to service people because they can come from all over when that happens.
Dr. Harris, what would you suggest to the audience or the people out there who's living in chronic pain every day? What's your recommendation?
There's so many recommendations out there. As you know, in America, the number one recommendation, it appears to be, is hydrocodones, Schedule II narcotics. And what has that done? That has just consumed our United States. As you know, the United States is the number one producer, the number one consumer of hydrocodone. They don't have the hydrocodone deaths like they do in the other countries, like they do in the United States. So what do I recommend? We used to do some pain treatments. About 2 or 3 years ago, the Texas State Medical Board decided that they did not want family physicians or internal medicine physicians or just regular physicians to be able to manage pain. So they went into this big debate about what's given too many products and what's not given enough. So physicians now are in a catch-22 because now we're scrutinized if we give more than 10 tablets. And even when someone goes to the emergency room, they may get 7 to 10 tablets, even if the doctor sees that the patient is in severe pain. So what do we do now? We have to try creative methods like pain creams, neurostimulators to try to stimulate the nerves and the nerve endings, so that can help. Acupuncture or different other pains, just to try to persuade the patients that things can get better. And then if all else fails, we have to send them out to pain specialists. So even though the United States has said that in most states that family practitioners and nurse practitioners and Regular doctors other than pain management doctors cannot prescribe opioids, what we call Schedule IIs, and even they give us a problem when we schedule, give Schedule IIIs. The opioid crisis is not over. The opioid crisis is far from being over. It's just the medications are just as abused as they were when we could manage the care of our patients with some pain. Now, I would say when we were managing pain, most of us did not give as many pain pills as our counterparts who give medications in pain clinics. But now, our hands are sort of tied, and unless you're on hospice, or maybe if you're in nursing homes, then we can manage your pain a little bit better. But it has become difficult.
Dr. Harris, we would like to know, do you see children as well as adults? And if so, at what age do you start?
Family medicine doctors are trained to see the family. That means from birth to old age, all ages. And with our time here, we used to see children, but as they create more and more clinics, the Children's Hospital or the JPS clinics, they pull from our clientele of children. Now, I've done everything from rural medicine, where we did everything from newborn nursery to emergency rooms, so of course I saw people of all ages. But because of the demographics and the placement of different types of groups of organizations of physician groups around and businesses around, they have pulled from our population of children. And that seems to have happened to some of my other physicians who enjoy the entire family as well. It's not that we selected not to, it's just the organizations have pulled them away from our care.
Dr. Harris, for myself, I would like to know, what method of payments do you have, and what insurance do you accept?
Well, at this time, we take mostly all insurances, as I keep talking about in every statement, I guess, just to pull in all of the neighborhood people. However, as you know, even with Obamacare and all the insurances out there, a lot of the American population still don't have insurances. So we set up a payment plan. Our motive is to set up a payment plan, but right now we basically have like a walk-in plan. But some of the clinics have a payment plan where you pay a certain amount a month, and if you pay every month, you can have unlimited visits, whether it's telemedicine or coming in. Because even if you have the unlimited visits, or even if you have a walk-in, you end up paying less money than you would if you pay the insurance guy. But somehow, we're still trying to get that out to the neighborhood. And also, since you've talked about pain, and you've talked about insurance, and you've talked about family, the biggest thing that's important is health, wealth, and beauty. When the person looks into the mirror, they want to know that I love me. And so they want to love themselves back to work. They want to love themselves back to the family. So we're creating a spa, a medical spa. When I started my talk, we talked about how allopathic medicine meets osteopathic. Well, we want to know, and we want you to know, how we're going to make it meet beauty. So we're going to have a beautiful setup for all of you who want to come out and not just hold the hand of someone in your medical care, but also in your beauty and your physical care. We're waiting on you. Please come aboard.
You have been listening to the Tony Teal Show, right here with Dr. Patricia Harris at 2529 East Lancaster Road in Funkytown, Fort Worth, Texas. Thank you.